Cancer. It's a big word that strikes fear so big that it drives most people without it to take actions that will avoid a diagnosis. Luckily, though, according to the Mayo Clinic, we have come a long way, and today cancer patients are living much longer. Mayo Clinic oncologist and researcher Dr. Ruben Mesa is here to talk about how the phrase cancer survivorship is being used to highlight their progress and journey following diagnosis. Doctor, thank you so much for joining us, and I know you're actually joining us from right up the road in Scottsdale.
Correct. I'm here at the Mayo Clinic Scottsdale, just a little north of you.
Now, I was talking a little bit about this phrase, cancer survivorship. Tell me a little bit about the power of this phrase.
Well, first we refer cancer survivors are anyone who's facing the cancer journey, whether they have completed their treatment and are cured, or whether it's an individual actively undergoing the process. We view survivorship as really all those things that really help a cancer patient feel supported and help them battle against their disease.
Now, of course, we know about the medical portion of, the fight against cancer, but we've come up with something that's the 10 keys of cancer survivorship that kind of goes a little beyond that.
Correct. Having a cancer is a very complicated illness, and there's a lot of aspects to it to help to battle against the cancer, to understand where you are with the disease, as well as to help you overcome the challenges that you face.
And so I know these 10 keys of cancer survivorship talk about kind of having a support system. It talks about how to kind of live a healthy life. Tell me a little bit more about what goes into these 10 keys and why it's so important.
Sure. So I'd say there's 10 key steps that I have mentioned, but I'd really break it into two key different areas. The first is really support. The support for the person, support from a caregiver and helping support that caregiver, support from knowing more about your disease, support from being a part of a cancer community to learn more about the disease, as well as having friends that face a similar challenge. The other key part is really around attitude and perspective. As I've learned from cancer patients, your attitude and perspective is important. Taking care of your health, the rest of your health, eating well, being active, and then really focusing on those key things that matter in life, which tend to be people, relationships, and those real important milestones in our life that really help to define what makes life special for us.
And Doctor, I know that you have said, you're the person that we turn to in a time like this in our lives, but you've said that you have learned so much from your patients. What does that really mean for you?
Well, one of the really rewarding things about being a cancer doctor is, having the chance to help people along a very difficult journey. And with that, there are a lot of lessons that people learn about life, what matters, and being a provider for them, I really am privileged to be part of that journey and to learn from them. What I've really seen from them is the things that matter when our lives are difficult are not work-related things typically. It's not around a promotion. It's not around a new car or the latest smartphone. It tends to be very focused around people, and key events and milestones. People tell me the things that matter to them are their daughter's wedding, a baptism, a graduation, those sorts of real life events that really are a focus around their relationships and those things that matter to them.
I think that's such a great way to put it, Doctor. And before I let you go, is there any last word you kind of want to put out there? I know I kind of alluded to this at the beginning about, we are seeing, people dealing with cancer living longer lives. Is there any last word you want to leave us before we let you go?
I think that word really would be hope. I think we've made tremendous strides against cancer in every way, whether it's overcoming cancers, people living longer with cancers, or people really living better with cancer. I think hope is a central theme in being a cancer survivor.
Well, Doctor, I can't thank you enough again for joining us, and we're so happy to see that such great work is coming out of Arizona, you just being right down the road at the Mayo Clinic in Scottsdale. Again, thank you so much for joining us.
Oh, it's a great pleasure. Thank you.
Now, don't go anywhere. The Morning Blend will be right back.